Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, podcast endorsed and sponsored by kidneysolutions.org.
Hello, everyone. Take a big, deep breath. We're going to do some podcasting. And man, do I have a great guest this morning. And as we always do, let's start with prayer and get our hearts right, especially during this Lenten season. Heavenly Father, please be with us today. Our hearts hurt and we feel overwhelmed at times. It's difficult for us to see the joy that only you can provide. Still, we trust in you and place all of our problems in your hands. And knowing that this kidney disease issue is always at hand, we ask that you look upon all those on the waiting list and for all those who have been freshly transplanted. But most of all, Lord, we ask that you bring those forward that don't even know they have the illness yet. Bring them forward and let us help them. We pray that you can open our eyes in the ways in which your love embraces us always. We ask this in your holy name. Amen. Well, it's great to talk to everybody this morning. I don't know when you listen to this, it's probably not going to be morning, but who cares? Anyway, I hope that this little podcast that we're going to do with our guest from Aakp sits well with you, that you can understand all the concepts. And really, if you would go in afterward and you listen to it and just go ahead and like us and go ahead and make comments, then help me improve the program. Doing a lot more of these. And so I think we're in well over 125 now. So it's a good ride. I'd also like to draw your attention to our Monday night support group, which is meeting every Monday night at 6 p.m. Central Standard Time. Last Monday, we had 51 people. That sounds like a chaotic situation, but believe it or not, these folks are all pros. They love coming to the organization. They come to the support group for that support, and that's what it is. Our guest speaker for the month is going to be next week. I haven't found the person yet. They haven't responded, but we'll get with you on that. And then our second annual Fun Walk is going to be held April 13th from 8 o'clock to 12 o'clock at Schreiner University here in Kerrville. I know if you can't come, if you could just go for the details on kidneysolutions.org, can tell you everything there is to know about this walk. And let me tell you, it's fun. We're going to be doing a lot of things this year, so think about helping us continue at Kidney Solutions with a free will donation and sponsorship. Thank you so much. Okay, so now I take a really deep breath because I'm really looking forward to this discussion with a very good friend of mine. Today we're going to be talking to Diana Clynes, who is the executive director for AAKP, the American Association of Kidney Patients. She's responsible and does an excellent job of implementing and executing the mission and national strategy for AAKP. Diana initiates and manages the organization's funding contracts and maintains and develops existing and new relationships within the industry, government, and organizational partners. And she works directly with the board of directors, which I'm proud to say I'm a member of, and of the executive leadership committee, to create program metrics and analyses to ensure that the missions and the goals and objectives of the association are met. I've known Diana for almost 10 years now, probably so. And she joined AAKP in 2005. And I must say, she is well versed in everything kidney. And I can tell you also that she has commands tremendous respect in the industry. So without further ado, good morning to you, Diana.
Hi, Kent. Good morning, and good morning to everybody listening. Thank you so much for having me, and thank you for that beautiful introduction. I appreciate it.
Well, you're kind of special in my heart. All the staff at AAKP, uh, they're hard to beat. I mean, everything they do, everything that we do in this organization, and I must say this with impunity, is always run smooth. It may not seem like it to you in your hectic ways, but I can tell you that the board meetings and just your communications with everyone and our advocacy programs, all the things that go on at AAKP, man, I'll tell you what, you're on a tight ship, a good ship, and I'm happy to be on it.
Oh,
So I've lost track. I've lost track of your family. I see them on Facebook, and your kids are growing. Can just give me a little background about your family?
yeah, no, thank you. I love talking about my family, so I'll try to be cognizant of the time. But my everyone's doing really well. I have a boy, James. We call him Little James because his dad is a James too.
I
So,
got you.
and I just couldn't see calling him a Jim or a Jimmy. So we've
No,
got two Jameses. But my son's 10 years old, and he's in fourth grade right now, and he races dirt bikes. So he's really active and keeps me, on my toes. And then my daughter just turned 15 this month, just gosh, on Saturday. So we're in high school now. So that's been exciting. She's been doing really well, made the high school JV volleyball team. She
oh
does
my,
travel volleyball, and now she's driving. We've got a learner's permit. So
you're
that's,
kidding me.
yeah, yeah,
Welcome
yeah.
to the big time.
Yeah, exactly. I have to admit, I wasn't, surprisingly, I wasn't as nervous as I thought I was going to be when she first kind of got behind the wheel. We did some practice and, local church parking lots and just around the neighborhood so she could kind of get the feel of it. But when we headed out on the road for the first time over the weekend, so a little prayer, but she did, she did great. She did
Yeah.
great.
When
So.
my granddaughter got her license, I told her I was going to stay off the sidewalks because afraid I'd get hit. So
Yeah.
tell them to stay off the sidewalks. Okay, so as a board member, I'm really proud to be a board member of AKP. Been very active. Um, in general, tell us how AAKP actually operates. Not the meat of it, but just in general, how you see AAKP working in the kidney space.
Yeah. So, this month, February 1st, I celebrated 19 years with AAKP. So I think I've kind of been part of every position in the organization throughout the years, and feel really honored to have stepped into the ED position in 2018. And so I have a lot of history with the organization and just have seen it evolve and grow over the years, and it's absolutely amazing, and it's a very passionate organization. It's everybody that is involved in it is very special. I mean, you go to other companies and other nonprofits, and I just feel like AKP has a very unique culture where it's more like a family.
Yep,
So that's
exactly.
yeah, so that's really what's kind of kept me just inspired and involved, and just, meeting some amazing people. But as far as an organization, we have our national board of directors, which is over 60% patients by bylaws. The president must also be a patient. So we are truly organization that was developed by patients for patients and run by patients. So, I take direction from the executive leadership. So our current president at Hickey is absolutely amazing. The one wonderful thing that I see with AAKP as far as our board leadership is we have individuals that once they get involved, they remain involved with the organization, and they just kind of advance through the board as officers and such. So the continuity of leadership has been fantastic for AAKP. And I think that's helped really continue to grow the organization and drive the organization in the direction that we want it to go. So, day-to-day operations, it's, me and the team. I've got a
Yeah.
fantastic staff. Some of us are headquartered in Tampa, Florida. Others are kind of throughout the US, which is fantastic too. And they're really special people and work really hard. And so we work really closely with our officers to just kind of drive the organization forward and develop, our strategy and the policies that we're getting involved in, and just simply, doing what's right for kidney patients.
I think that's where it all originated. I guess it was, I
Mhm.
think I can't remember what year, 69, I believe. It's been over 50 years since AAKP started. And it
Yeah.
started out with a group of dialysis patients who actually formed it. And so it
Mhm.
has been patient-centered and focused, and that's what's good about the organization. Another thing too is it's free to join. You don't have
Mhm.
to you don't have to pull out the checkbook. It's
Right.
free. All you got to do is apply at aakp.org, and
Yeah.
that's
A
it.
yeah, aakp.org /join, and you can join as a free member. It's, the sign up is just an opportunity to share a bit about yourself with us. That way we can make sure we keep you as a member informed about what's going on in the kidney community, whether it's, AAKP event, a program, something new we're releasing, or there's a policy issue or some sort of advocacy effort underway that we need to rally the troops about. This,
Absolutely.
signing up kind of gives us the opportunity to keep you informed and give you the opportunity to get involved.
One of the things that everything's laid out for you when you become a member. What are the 3 or 4 signature programs that AAKP is currently using or doing? What are those key programs that are penchant or something that AAKP is very well known for?
Yeah. So, gosh, it's kind of hard to narrow it down, but I think I'll kind of answer it like twofold. So AKP has a number of signature events that we
Exactly.
do that are very unique in their own right. So we host a global summit on kidney disease innovations. That's an event that AKP has done since 2019 in partnership with the George Washington University School of Medicine and Health Sciences. We also host a annual policy summit, which we started back in 2018. And we also host our national patient meeting that's typically always held in September. And this year will be our 49th national patient meeting. So those are our largest events.
Those three
Yeah,
events. Yeah. Yep. They're
yeah.
and you can go on the website and look at those, and it explains them all.
Yeah, they're really fantastic events. We make them applicable to everybody, but there's some folks, they definitely have their favorite
Yep.
AKP event. The exciting thing for this year is for since in 2020 when COVID hit, we transitioned all of our events to virtual. and they were hugely successful. We had the ability to reach, thousands more individuals, being able to offer these events on a virtual platform. But this year we're excited because we're starting to transition these events back to in-person. So there'll still be the virtual component where individuals can register for free and engage in the platform. But we're also offering in-person opportunities. So I know we're excited about that. I know a lot of our members and those in the kidney community are excited about that. So for those who feel comfortable going to in-person events, keep your eye out, because we'll be releasing more information about our signature events and how you can get involved and where those will be located.
I can tell you for a fact that once you, become a member, and the chances of you being involved in these situations are very high, because they, at the staff, that Diane and all of the folks at AAKP, try to make sure that there's a huge amount of participation by patients and caregivers. All right. And the focus is on patients and caregivers. And so you'll see a lot of guest speakers, but it'll all be moderated and run. All these different programs are run essentially with patient involvement. And that's what makes AAKP so unique.
Yeah, absolutely. We always say, be careful what you wish for when folks will come up to us and want to get really involved, or, want to learn more about our ambassador initiative, because if you're willing to get involved, we are more than willing to have you. There's so many opportunities that individuals can take advantage of, based on their comfort level. Some individuals just really enjoy pushing our messaging out and our content, which is fantastic. And then we have others that are really wanting to get involved in some major activities, whether it's technical evaluation panels that CMS is calling nominations for, workshops with NIH, NIDDK, being part of a patient council that's reviewing clinical trial materials. There's just so much work to do, and we love having as many volunteers as possible, and making sure that we're providing opportunities that they're most comfortable engaging in.
Another interesting point about AAKP is that it's global. You mentioned the Global Summit. It is the program that's I've really enjoyed as being an advocate for AAKP. And that advocacy program, can you explain that a little bit? I know that Aaron went into it in detail, but how does that fit into the overall AAKP mission?
Our global efforts, or
yes, and advocacy, how we marry those two organizations or groups.
Yeah. So, advocacy is really what AAKP was born out of. Having those patients that developed AAKP and banded together, their initial purpose was on advocacy efforts to make sure that others who had kidney failure had the same opportunity to receive dialysis as they did. The organization was successful with helping pass or get past the Medicare ESRD program. So, advocacy has really been one of the cornerstones of AAKP that we're very proficient in, and we have the great fortune to have some board members such as Ed Hickey and Paul Conway and Richard Knight, that even in their day jobs, they know policy and government inside and out. So that's been really helpful in making sure that we're effective in our efforts. So, AAKP Global was, really kind of born out of the fact that, kidney disease has no, borders.
No borders at all. Yeah.
And, there's patients around the world that deserve treatment and choice and the best life possible. And so, we've been approached, gosh, over a number of years, just from individuals and patients across the world asking, how can we do what you guys do? And that really came to light in 2018 when Paul Conway, who was president of AAKP at the time, was invited to a United Nations event and just kind of saw how other countries were treating individuals with kidney disease almost like a burden. And so
Right.
he came back and said, we have a formula here, and we have a way in the US where, we take care of our patients. We want to advocate for our patients, and we're being asked, how can others do this in their own country? So that's really how AAKP Global was born. It's trying to help patients in other countries, provide them with the resources we have, and then kind of help them with their advocacy efforts. And then, of course, the partnership with George Washington
Oh,
being
wow. Yeah, that's so
global.
unique.
It was just, it all came together really nice. So that's really how AAKP Global was born. And then Erin Kale, who oversees our ambassador initiative, started recruiting global ambassadors. So we have a huge national ambassador base. And so we've branched out, and I know she has over a dozen countries represented by international patients.
Yep. And they're all active too. You get to know them just like you do the folks here in the States. And I think there's, warriors in every state from AAKP. So that's really nice to have representation like that. Let me ask you, what do you see as the most pressing issues facing the kidney community right now? That's pretty broad, a broad question, but what are you seeing? What are you seeing on a pretty much daily basis that needs to be really worked to make the world better for kidney patients?
Research and innovation, changing status quo kidney care. If you look at other disease states comparative to kidney disease, we've really lacked in evolving our treatment options. And we, through the past three presidential administrations, there's really been a focus on kidney disease, which has been fantastic. AAKP kind of coined the decade of the kidney from 2020 to 2030 as a time period that we're really going to be pushing for change and innovation, and just kind of getting all the players on board, whether it's healthcare professionals, kidney communities, policymakers, just everybody driving towards innovating and changing status quo care. So we're seeing the innovation. I think, as of late, I think some of the most pressing issues has been the ability to get those innovations in the hands of patients. So you can innovate, but if individuals don't have access to those new devices or treatments, or their physicians aren't able to prescribe them, that's unfortunate, and that's a huge barrier that should not be in place. So while we're innovating, we also need to make sure that these treatments and devices are being made accessible. So that's where FDA comes in, and of course CMS will come in with aligning payment and regulation and access.
That's exactly the answer I figured I was going to get, and it's great because that is what it is. It borders on access, but also the ability to get these things out and working in the community. Try to get them ready and out. And I felt over the last couple of years, there's been a surge in pharmaceuticals and in just about everything in the field. But I still wonder, I still question the sense of urgency. I don't feel there's a big sense of urgency. Maybe I'm getting older, but it just seems like you see all this stuff, but how urgent, or what part of the agenda uh, does kidney disease fall in? Right?
Mhm.
It's in a lot of rare diseases involved in it, and it's tough to get research dollars now. It's much more difficult, but there are a lot of programs, and AAKP is working with a lot of these organizations that are doing research, like
Mhm.
well, for instance, working like with NEFCure and working with other agencies that are in the forefront of research and development. And
Right.
Paul and you and the whole group have really been very influential in making these things go forward. They press it all the time. It's a full court press, constant pressure to
Mhm.
get it out there. But I don't know if they're in the community, if there's a sense of urgency. And a lot of people are very, very sick and they need this innovation. So
Mhm.
what do you think? Do you see that there is progress, or is it kind of stagnant, or is there a sense of urgency?
Yeah, I'd have to agree with you. There's we have seen an uptick in research and innovation. Then there's that issue of making sure individuals have access to it. I think, we're getting towards that sense of urgency, but I understand where you're coming from, because it's not always there 100%, and it needs to be. And, that's really a reason why AAKP developed a couple of our other initiatives, one being patient voice, patient choice, where
Exactly.
we identify some sort of barrier that is impeding patient choice and access, and we shout it from the rooftops. And we've developed a platform where we can educate individuals on what the issue is, and then a mechanism to take action. It's important to hold, you know, folks accountable. So whether that's policymakers, federal agencies, or what have you, to make sure that individuals have access. And then, on the flip side, we have our kidney voter initiative, where I'll steal a phrase that former AAKP President Richard Knight always says, that policymakers can count. They may not
Exactly.
understand everything, but they can certainly count. So, being a kidney voter means, A, making sure you're registered to vote, B, understanding the issues that impact patients, and then C, making your own informed decision, and, applying your vote the way you see fit. So that's another way to put pressure. But like you said, it's constant pressure. You can never,
You can't give up. You can't
yeah.
slow down. I mean, that's what AAKP is so good at. Time you turn around, there's a, a, a paper out or some kind of information generated by the AAKP group that tells you everything you need to know about in the kidney world. But they challenge you to dig for yourself.
Mhm.
Don't just wait for platforms to show up. You need to get in and see what kind of bills, what kind of legislation, what kind of policy, what kind of things are affecting kidney disease, because we get lumped in a lot of the times with other groups like diabetes or heart disease. We're not a sole entity like those are. And so we
Mhm.
have to press constantly to make sure that we get the word out, and AAKP does a great job of that.
Thank you.
I think there's a fine line between joining a group and being active in a group. How many times I've thought about this is that many times people will join to say they've joined, but how how do you dig in? Where do you dig your foxhole? Okay,
Mhm.
at what point do you really want to engage, or are you just there to listen? I think it's very important for people out there right now with kidney disease that they sign up for AAKP. I think that we've tried to, every time we talk about things in the group, we mention the many groups that are available. But AAKP has a patient flavor, if you will. They are well versed in patient concerns, and when anything comes down the pipe, I can tell you it's scrutinized heavily by AAKP to see how it's going to affect patients.
Mhm.
So
Yeah.
that's my take on it, and the organization runs with people like you, and we're glad to have you. That's very important to have someone who is as focused and knowledgeable as you are.
Thank you. Yeah, I mean, th- time is certainly of the essence.
Yeah.
One of the most difficult things for me personally being part of AAKP is just, losing people that I've met over the years, the disease. And it just makes you want to continue to fight and do the right thing and just try to make as much of a difference as you can. So getting involved is the most important thing, and try AKP on for size if
Absolutely. Yeah. It doesn't,
you know.
it's free. I mean, get with it, right?
Yeah.
Give us a shot. And I tell you what, there's plenty to do here in this world. After people get transplanted, and this was my case, there's a tendency to, the first few months and years, is to just get yourself squared away. Being able to take your medicines, get your appointments, do everything you need to succeed and keep your kidney. But one of the things after a while comes to mind, you want to pay back, you want to give back, right? You really want to get in the fight, okay, to help others. It's not so much about you, it's about the folks that are coming behind us, or essentially the ones that are freshly transplanted. And when it comes to transplant, it's a very difficult thing to maintain. Surgery is fine. You can get through the surgery well. It's how well do you maintain afterwards. And I can tell you, I've met a lot of people in AAKP, members of the organization, advocates, who've enlightened me on how to move, how to function as a transplant patient. It's different. It's not a cure, and I can tell you, there's times and travails, and we do lose people. People they do die, and that's one of the things about this illness that makes it so captivating is everybody's different. Everything works different for everybody. That's why everybody needs to have a mentor, be, on the same terms.
Mhm.
So AAKP has a very big part just in general in education. And it amazes me how much information boils out of this organization. I mean, you go to aakp.org, and it got everything from nutrition to exercise to just coping with mental strains and issues of dialysis and of transplant, and it's well spelled out and it's all vetted. The information you get there's not internet stuff. This is real vetted and down to earth, readable and understandable educational materials, and you should go to the website and look at it.
Yeah, and the thing with our materials too is not only that, but they're informed and reviewed by patients. So, it makes sense. It's what the questions that a kidney patient would want to know may be different than what their physician thinks they should be asking, but it's all important. And so it's really important for us as an organization to make sure that, yes, we have all the clinical medical information, but we're also addressing all those other needs that individuals have with, just living their life, the support,
Mm.
mental coping, all the other things that sometimes fall to the wayside when somebody goes into an appointment and, is asking questions. So we serve individuals across the disease spectrum. So, we're really trying to identify and help individuals that are at risk for kidney disease, those who've been recently diagnosed, all the way to individuals on dialysis and, those who have a transplant. So we have a wide spectrum of materials, and we're always providing new information, and we love getting feedback from the community if we're missing anything. That's how some of our materials or our web pages have come to be, is somebody will reach out to our info account and say, hey, do you have any information about this? And we may have a little bit, but maybe we need to take a step back and create something more. And so we'll go ahead and work with folks to put together more web pages, brochures, webinars, make sure we have content on demand, because one of the great things with AAKP is what we provide doesn't stop day of event. We make sure that it's
Exactly.
accessible, like far beyond, and that way we can reach and help as many people as possible.
That's so true. I mean, it's an ongoing effort at AAKP, and it's all patient centered. So it's time to really get on board. If you're interested, you just go to the site, aakp.org, and sign up. That's that simple.
Mhm.
So I want to just also tell you how much I appreciate AAKP's support of Kidney Solutions in our drive and strive to be mentors to people out there with kidney disease. Um, we consider ourselves a mentoring program. We're not donor hunters. We help, but we're not. That's not our main focus. Our main focus is on, like much like AAKP, on the patient. Uh, Transplant's easy. Get a transplant, and then make sure that you keep that transplant.
Mhm.
It's near and dear to somebody. Somebody gave that kidney up for you, so it's your obligation, and you need to be hell bent to make sure you take care of it, and that's the kind of services that we provide. Um, I I think we've touched just about everything that we can. Is there anything in your mind that you think we ought to go over, or that you would like to mention before we kind of close it down?
Oh gosh, I think we've hit on everything. I would just say, um, check out, for those who are not familiar with AAKP, check out the website. We don't have chapters or affiliates across the US, which is why we developed the ambassador initiative. So we have boots on the ground, and it's why the AAKP is so supportive of our fellow organizations such as Kidney Solutions and Kindness to Kidneys, because we want to make sure that we're supporting other organizations that are in communities that are helping folks when we may not be able to be in that specific area. So we provide so much information, and we try to connect individuals with other organizations that can help them out in their state. But we have a lot of great things planned for 2024. It's going to be a busy policy season. It's an election year, so kidney voters
Yeah,
really going to be
yeah,
heavy.
yeah, yeah. It's all going to be there. Well, I always think more to talk about, but the content that we've shared here today is very pertinent. And I guess just to sum everything up is just go to aakp.org and enlighten yourself and share it with others. When you hear something like this and you subscribe to the podcast, what you're doing is then telling people that it's a worthy cause. You need to be cognizant of all the things that go on in this kidney world, and AAKP can supply that. They're a wealth of information. So find yourself a position and time to go in and look at the website and immerse yourself. And if you want to join, please do. And if you have any questions, you can contact me at area code 830-285-2140, and I'll tell you about AAKP. Be more than happy to discuss it with you, answer any questions. And you can also call the office at AAKP. They will, I guarantee you, enlighten you and help you through the process of becoming an advocate or a member. And we look forward to keeping a close contact with Kidney Solutions and AAKP. We do a lot of podcasts with the patients who have been involved with AAKP, so we'll continue that project also. Okay, Diana, I'm going to thank you so much for coming in. You know, it's hard to stop these things because you just want to keep going, but we can't. You have obligations, I have obligations, and I have a long list of let's do things for Kathy this week, so we'll get started early on those. So thanks for coming in. Let me just stick around here a minute. Let me just tell everybody that make sure they remember always to pay attention to what your body's telling you. All right. Too many people in this system get sick when they have kidney disease, whether they're on dialysis or they're transplanted. Don't take symptoms lightly. Don't just poo-poo them. Don't look over them. Make darn sure that you get medical care. You are different than the general population. You can't always fight these things off. You can't go to bed and you'll be better in the morning. But there are treatments out there. I want you to remember that. There are many, many new treatments for kidney disease and definitely for immunosuppressed patients. If you have a fever, if you have a headache that it just doesn't go away, sore throat, any of the symptoms of a viral infection or any type of infection, I implore you to see your physician immediately. At least call and get it, get through some type of urgent care area. Do not go to bed with symptoms. Get them taken care of, because if you don't, you might be on the short end of the stick, and we want to keep you around. We want you here for a good while. That means take care of yourself. All right, enough said. Thank you so much, Diana Clynes from AAKP. And I'll let you know, everybody needs to keep breathing.